project is to improve safety, quality, and consistency of patient care throughout VCH, PHSA, and PHC. And we're trying to configure for an enterprise design, which means that the design elements are standardized and similar across all sites. And we aim for a connected healthcare system that works for patients and the people who care for them. There are 4 project drivers. We want to reduce error and adverse events to improve quality and consistency of care, to improve the healthcare experience, and to gather better data in order to improve the healthcare system. The purpose of this session is to provide the subject matter experts the opportunity to validate the workflow, core locations, and any outstanding questions applicable to the Richmond endoscopy and bronchoscopy, and also to identify any gaps that still need to be addressed. You're going to hear some of the terminologies come up during the session. For example, PowerChart is the application we use for clinical documentation, and assay anesthesia, or short for assay, is an application we use for documenting anesthesia sedation record. Also, the scheduling appointment book, also called the SHAP book, is for scheduling. Access Management Office, also called the PM Office, it's for registration. Workflow Monitor, it's like electronic fax. Periodic Tracking Board is a surgical slate. Power Plans is an electronic order set or PPO. Power Form is an electronic form. And iView is just an electronic flow sheet. And the bedside medical device integration is the monitor that auto-populates vital signs into patient chart. Okay, and I will hand it over to Stephanie.
Hi, everyone. I'm a business analyst with the surgery and anesthesia design team. So I'm just going to go over the clerical workflow for endo and bronch that we are looking to validate today. So the surgeon's office will fax over the booking package and slate to the endoscopy booking clerk. The booking clerk will associate the booking package in WorkUM to the patient's chart. They will create a pre-day surgery encounter and place the patient on the wait list. And then when they receive the slate with the patient being scheduled in, they will pull that patient off the wait list and schedule their appointment. Specifically for endoscopy patients, if EndoPro interface is live when Cerner goes live, Cerner generates a case report in EndoPro for the provider to report on. So that's all prior to day of surgery. Day of surgery, the admitting clerk will register the patient, and they'll flip that pre-day surgery encounter that the booking clerk created to a day surgery encounter, and they'll prepare the patient's chartlet. So we have agreed that we're going to align with what VGH is doing. So 1 face sheet is printed, 1 armband, non-blood specimen labels times 10, and 5 patient labels. Then the ambulatory NUA will confirm the patient's ID and ride information and update the tracking board status to say that the patient is in the waiting room. So any questions about what we just went over? I will show it all in the system. Okay. I'm going to share my screen if you want to stop sharing, Tommy.
Yep.
Okay, so this is PM Office. So the conversation type we'll be using, or the clerk will be using when they receive the booking package, is the surgery waitlist conversation. This is everything I showed in our enterprise overview, but now I'm just going to show you with Richmond's locations. This is our test patient. Correct. So they would search up the patient. They can search by healthcare number, MRN, or by the patient's name. And we're going to be creating a new encounter. So I'm going to add an encounter, and then I would search for our facility. So Richmond Hospital. And then our surgery waitlist conversation pops up. Again, everything in yellow with the red asterisk is required. in order to create the encounter, we're going to put them on the wait list. Here, you put in the provider's name. Oops. We use Christmas of 2 years from now just to show that we don't know when the patient is coming in. If it would just allow me to do that. There we go. And then noon. And then the other tab that needs to be filled out is just the booking package date information. So referral date, first consult date, ready to treat date, and booking package receipt date, which all comes from the booking package, and then whether cancer is suspected or not. And then I'd click complete, and I've created my encounter for the patient here. Then the clerk will go to the scheduling appointment book. So you can see we have our bookshelf for Richmond Department of Perioperative Services. Each book here represents a different area in the hospital. So we right now are looking at endoscopy, and these are the resources we've created for you to book into. So we have the 2 endo rooms, the 1 bronch room. We have 3 add-on spaces, so just add-on cases, those done in the ER, and then those done in ICU. Okay. So we use the surgery endoscopy appointment type. Our location will be Richmond Endoscopy. And then I'm going to search for my patient using that same person search window. And I'm going to look for the encounter I just created. So here's my patient. Here's the encounter I just created. I'm going to click OK. Again, all the fields that are yellow with the red asterisks are required in order to create the appointment. This BC diagnosis code would come from the booking package. And then you can put in comments into the surgical, public surgical comments that'll pull into the tracking board, which someone will show you later on in our demo. And then you would put in the procedure that's happening. So let's say we're doing a colonoscopy. They can write out here exactly what the patient consented to. And I can also update the procedure times if need be. And I can click OK. Okay. And then at this point, you have 2 options. You can either schedule the patient in for their day of surgery if we know when they're coming in, or you can place them on the request list. So I'm going to put them on our request list. And you can see here that we have a Richmond surgery wait list, and that's going to place my patient on the request list. When the clerk receives the slate and the patient is ready to be booked in, they would just take that patient off the request list. So just filling out these fields. So the inquiry is surgery case request by Q. We want it to be the Richmond surgery wait list. And then our location would be Richmond Endoscopy. Here, click find. So this would show all patients on the list. You can see we only have 1 because this is just our testing domain. I right click, I want to complete my request, and it's going to bring me back to that appointment attributes window where I put the order in. Again, allows me to update any information that's required. Going to the details tab will show everything that I put in up here in this appointment tab. And then when everything is as it should be, I will click OK. And now I can drag my patient in to the date and time that they need to be scheduled for. I can click confirm. And this yellow case is now going to turn blue, and the case is booked. Is there any questions about the clerical workflow or what we have built for Richmond specifically?
Hi, it's Mary.
Hi, Mary.
Hey, I just have a question. So just so I understand, because I'm trying to get the process in my brain. So when you put them on the queue and we get them from the MOAs, it goes into the power chart. Is that right?
Yes, correct.
Okay. So
So
then, sorry, and then once they're in there, then we have to put them into the scheduling once they're scheduled or have a slate. Is that correct?
you'll receive the booking package in WorkQM.
Yeah.
Yeah, so then at that point, the clerk will create an encounter and place the patient onto the request list. And they'll associate that booking package to the patient's chart. So you would see it in Power Chart.
Right.
And then later, whenever the patient has been booked in, the clerk will then receive the slate with that patient booked in on their date and time. So they'll go to that request list here. And because they've done all the work already, like they've already created the encounter and the appointment, all they need to do is pull that appointment off the request list and book the patient in.
Got it.
Does that answer your question?
Yes, thank you.
Of course. Any other questions before I hand it back to Tommy?
Sorry, yes, Stephanie, it's me again. Will this be shown to us as a add-on, like an urgent in-house, or is this just elective right now?
I can show you what it looks like for an add-on case.
Because we're still, it's the same.
It's relatively the same. The only things that are going to change are like the appointment type you use. So for an add-on case, there usually is already an encounter created because they're probably an inpatient in the ER or, they're in a ward somewhere. So you would just use that the encounter type that's already been created. And then your appointment type is a surgery rapid. And it just changes a lot of the required fields that you saw before. So I can still put my location as endoscopy. For this case, I'm just going to use the same encounter. So I'm going to use this one here. And then you still have to put in the surgeon. Patient type is still required. So let's say they were still inpatient. Now you see I have to put in the priority of this surgery rapid case. So that's something that is new. And I'd put in the pre-op diagnosis code that was communicated to me. And that's everything that's required. So you see there's no like BCDX diagnosis code that I have to put in. So some things that are different. And then just the date and time that the request came in. I click move. Again, I put in the order. And then usually what happens is if you don't know like where this case is going to be done, that's why we booked this add-on room for you. You can just schedule them in here. So the case is booked. And then like in surgery, they can update the room that's in it. Like the nurse can do that in peri-op doc. So all the documentation is correct. The clerk can also move it if they find out prior to the case being checked in, they can move it to the correct room as well. Does that answer your question, Mary?
Yeah, thank you, Stephanie.
Of course. Anything else? I will hand it back to Tommy then. Thank you.
Thank you. Okay. All right, so next we're going to pre-op, and then I'll hand it over to Tammy.
Thank you, Tommy. So hi, everyone. I'm Tammy. I'm the peri-op CIS. So I'll talk about the pre-op nursing workflow on the day of this procedure for endoscopy patient. So starting at the beginning, the pre-op nurse will do the bed transfer for the patient. They will review the endoscopy assessment, consent, and sign the pre-op pre-procedure checklist with the patient. Depending on the procedure that the patient is going in for GI endoscopy, we will discontinue the
Sorry, Tammy.
Sorry.
Just a second. There,
No
I just
worries.
realized it's the wrong slide. Sorry. There we go. Okay.
There we go.
That's
Yes,
better. Okay.
thank you. All right, so starting from the pre-op stage, for the pre-op nurse, we'll change the status to patient in the pre-op. So I'll show you in a second in the demo on the peri-op tracking shell. We'll also do the bed transfer to reflect the bed location for the patient. For the check-in interview, the pre-op nurse will complete the endoscopy assessment and the peri-op pre-procedure checklist power forms. Depending on the procedures for the patient, we will initiate either the GI endoscopy multi-phase pre-procedure phase of the power plans or the pre-procedure phase of the rest pulmonary interventional multi-phase power plan. And for documentation in the I-view, which is the flow sheet sections, there is the endo quick view band for the nurse to chart patient-specific activities. For any pre-op medications or IV fluids to be administered, it will also chart that in the medication administration wizard. And once the pre-op checking portion is complete, we'll update the status and then it will show that patient is ready for surgery. Any question for that? Okay, and then I'm gonna go into the demo section for the workflow. Just gonna start the sharing. Thank you, Tommy. Can everyone see my screen?
Yep.
All right, thank you. So here we are in the perioperative tracking shell. So here you can see all these location tabs. I've loaded RHS endo pre-op tab to show that this is the slate for the endo space for today. This is the filter to show that these are the cases slated for today. As a pre-op nurse, I'm going to see that my patient is on the shell. Here you can review any key information about the patient, the current status of the patient. Patient is in the waiting room, the start time for the procedures, the encounter type of the patient. There is allergy documented for this specific patient, the patient's name, age, procedure for this patient, provider. And there's also extra boxes for comments, etc. Okay, so to access the chart for this patient, we'll go to this right blue arrow. Before I do that, I want to update the patient is now going with me to the pre-op space, so I can set the events here. So you can see all these tabs. We're in the pre-op space, so we're now going to say patient in pre-op. So now patient is coming with me to the pre-op space. I'm going to open this chart. We're going to assign a relationship. I'm the nurse checking in the patient. This will assign a relationship up to 13 hours. Okay, so now we're in the patient's chart, and this is the default page, the perioperative summary. And here you can see different workflow tabs just to have a quick access into different parts of the patient's chart. You can also access different parts of the patient's chart via the menu bar here. Here, this is called the banner bar for the patient. So we have the patient's name. We can see the allergy status for this patient, any key demographic informations, also locations, encounter type, etc. So once I move the patient to the pre-op bed, I also want to show this location. So to do that, we're going to go to PM conversations or bed transfer. So most of the information has been pulled in already from the patient's chart. We just have to go back and fill out these yellow blanks. So we're in RHS hospital. We're going to RHS endoscopy, and we're going to check for bed availability. We're going to assign this patient into procedure room 2. which is available. Okay. And transfer date would be today. And we're going to transfer now. And then complete. And then once we refresh this, so we want to refresh the chart as frequently as we can. And then we can verify that patient's location is now updated right here. So now, as a pre-op nurse, I want to check the patient's consent. So to do that, we can either access the documents here, or we can do it via the menu bar to go to the documentations here. We can quickly go to the endoscopy booking package. So once you click into the booking package, this is where you'll usually find the booking package that's been faxed over from the provider's office, and then you can check out the consent forms. Code. This will be the consent. And then the most form. Okay. All right, so next we're gonna go and see if there's any orders for the patient. So to go to orders. So as mentioned before, we're gonna initiate the pre-procedure phase of the multi-phase power plan. Here you can click onto the pre-procedure part of the multi-phase power plan, which is the equivalent of the PPO. As a nurse, I'm gonna review the orders. And then we're gonna initiate because now the patient is in the pre-op space. No co-signature required to initiate this section. And then we're gonna sign. Fresh. So now it's been ordered. Now these are active order for this pre-op space. Next, we're gonna go to ask some questions for the patients as a check-in interview. So we're gonna go to the ad hoc, which is the equivalent of like a filing cabinets for all the PAR forms. So we have an endo folder, and then we're gonna check out endoscopy assessment and perioperative pre-procedure checklist. We're gonna chart. Okay, so it opens up the PAR form. So you can see some of the information has been pulled in already from the chart. And as mentioned before, there are some mandatory sections to finalize this PAR form. So that will be the red asterisks or the yellow fields. So we can check out this form as we go. We're going to complete the patient screening history. So for allergies, this patient is shown to have penicillin. Marcus. For vitals, whatever we put in here, it's gonna flow into the interactive view, the flow sheet sections in a little bit. So I'll just quickly type in some values. So patient screening history is where you're going to complete for the check-in interview. So we just want to make sure the patient has the conditions. We'll say no for these conditions. Depending on the unit policy, there's a lot of information here on this PAR form. So we'll advise the nurses to go with what the unit has set out to fill. Medication history. So here, this is the active order for the pre-op phase. And then there's also the external review of medications, so like home medications for the patients that will require the nurse access to the Prime PharmaNet account. So patient's information instructions. This part here we'll have to fill to finalize the form. Violence and aggressions. None for this patient. It's part of the PAR form goes on for other parts like pain scale, false risk, social history, procedure history, family history, so on. So once this form is complete, then we're gonna sign. And then we'll pop up the other form, which is the perioperative pre-procedure checklist. So we're in the endoscopy space. Let's get started. This morning and last night.
Start with this UDD approved VGH training. And then we'll see if anyone wants to speak about this again.
And then there's more yellow fields, so we'll check out this one here that we verify the patient's ID band, allergies band on for the patient, and COVID screening. Here we're going to say we check the consent, so we yes. Got it for this form. There's also a place to chart about valuables and belongings for the patient and not any progress note, like a free text space. So once I'm done, I'm going to sign. And if I want to review the forms again, I can go to form browsers and it's going to show up here, perioperative pre-procedure checklist and endoscopy assessment form. Any questions so far? Okay, I'm going to move on. So I've initiated the orders already. I'm going to check in if I have to give any medications for the patient. Here, the patient is ordered for sodium chloride, continuous infusion. It's not been given, so it's pending. So to give any medications, I'm going to go to medication administration. So for giving out medications for Cerner, we're going to use the closed loop medication communication. So we have to scan the patient wristband. We just follow the prompts. And here we're going to click onto the medications we want to administer. So there's a yellow field. So we're just going to check on the site. Let's say I put in an IV for the patient. So it's going to be on the left. And I'm going to sign. There is no barcode to be scanned on the IV bed. So we're going to bypass that. So when it's been signed, it shows as complete. Next, I'm going to document any patient-specific activity so that we can do that in the interactive view, which is the equivalent of the flow sheets. So there's a lot of bands here. So that's different categories of the flow sheets. And for endoscopy patients, we have endoscopy quick view. So for the vital sign, because I charted earlier and the PAR forms, it pulled into the flow sheets here. And there's different sections again for different documentations depending on the unit's policy. So there's the sedation scale, airway management, post-procedure patient discussions. Because I initiate the IV, continuous IV infusion, I can chart about the peripheral IV inserted. So here you can see this little square here. That's the dynamic group. I'm going to click into it and then can chart about the IV. They put it in the pan, as I mentioned. On the left. And you can chart more about this IV depending on the unit's policy. So if you click onto it, you can say it's inserted or assessment. How many attempts, line status. So you double click it, it shows you more options. As we go on for the flow sheets, there's more bands to documents. So we have discharge criteria, pain assessments, all these. Okay. Any questions? And once I feel that I've completed the pre-op check-in for the patients, I've administered the medications, I've charted the IVs and charted the PAR forms to show that the patient is now ready for the procedures, I can go back to the perioperative tracking and I can update the status for the patient. Ready for surgery. If there's no questions, then Tommy will take it from here to show the intra-op base for the patient.
Thank you, Danny. Okay, so for intra-op, the nurse will complete a bed transfer into the procedure room, review the endoscopy assessment form, consent form, and sign the periop pre-procedure checklist. For GI endoscopy, the nurse will discontinue the GI portion of the order and initiate the GI pre-op portion of the order and initiate the GI procedural sedation. For bronch, discontinue the rest pre-op orders and initiate the intra-op orders. And next is to launch the sedation record, which is in the surgeon anesthesia, and associate the monitors. Next, it's to check in the patient through the periop doc, intra-op record, to document and finalize intra-op record in power chart, to document and finalize sedation record in SA, and to label any specimen as necessary. And I will demo that. Okay, so now we're back on the tracking board. So for the intra-op, we still want to use the RHS endo pre-op tab. I just want to mention the patient that Stephanie added earlier. You can see under scheduling comments, she made a note here. And then any add-on patients will show here as a plus. Okay, so now we're going to select our patient, which is this one. You can see that the status has changed to ready for surgery. So I want to double click on that. Okay, so this is the same default view. So the first thing we want to do is to transfer our patient into the procedure room by going to the PM conversation bed transfer. So for now, our endoscopy has the rooms, and then the day bed has all the other beds for pre and post. So we can look into combining these, so it's easier. So for now, I'm going to transfer this patient into procedure room 1. I'll go OK, and then you'll auto-populate the room and the bed number. And then just going to say transfer date is T is today, and then now is now. Okay, and then it will update on the banner bar here. And next, we want to review our endoscopy assessment form, which is available under Documents. And if the textual rendition is hard to read, you can click on this Modify icon, and then it'll bring you back to the PowerForm version. And I'm just going to cancel. So next, we want to review our pre-op pre-procedure checklist. And the same, we want to go to our modify icon. And this time, we want to review our checklist. We want to scroll down and then select review by OR nurse. And we want to do the same on the second tab here. So if the procedure consent has been completed, we'll say yes. Scroll down. And then we'll say review by OR nurse. And once we're done, we can just sign the form. And every time you make any modifications, document will say document has been revised. Okay, so next we want to go to our orders. So we always want to discontinue the previous phase by right-clicking discontinue. We're going to click OK. Oh, and also if there are items you want to keep, you can select that. Otherwise, you just select OK. Give it a name. No co-signature required. We'll just go OK. And then we'll order for signature, sign. Okay, refresh. And then I'm going to initiate my intra-procedure order so I get all the medications. So initiate now, no co-signature required. Okay. Order for signature, sign. And then refresh. So now we see the midazolam and fentanyl are ordered. Okay, next we want to launch our SA anesthesia, and it's normally in the launch bar up top here. It will look like this. So the most important thing here is to make sure the surgical area is relevant. So for us, it's RHS endoscopy, and then the date is correct. Okay, and if we search, we'll see OR patients here. If the patient has a sedation record created previously, you'll see the blue check mark here. Okay, so for now, we're going to select this one because that's our patient. I'm going to go OK. Just to double check on the demographics, select yes. So normally in a live environment, you're going to select your monitor, but because this is a test environment, we have no monitor to select, so I'm just going to cancel. And then it's asking for start time, so just make sure the patient doesn't go in. The patient start time is not before the staff start time. Okay, so we're going to select yes. And then here we want to continue the order that we just initiated. We want to click on the fentanyl and the midazolam. Going to go OK. All right, so here you have the gray toolbar here with all different tasks you can do. And we have the similar banner bar with the patient name, demographics. We have our workflow area here on the left side, our monitor and vital sign graphings here, and then our events here. So first thing we want to do is to go to our macros. So macros is just a set of events and tasks that run automatically. So we want to select the sedation with orders. Okay. And then here you see execute and to do. So execute means as soon as we click on the execute button, you'll flow to the record right away. And the to do is just to sit on the to do list. I'm going to deselect the to do for now because the patient in room and surgery start time should come from the peri-op doc, which I'll show you later. I'm just going to execute. Okay, and next we want to go to personnel to add our staff. So whoever opens the essay record will already be here. So there should be a nurse here available. And then for a physician, we want to go to add, and you can select from the tabs or search. I'm just going to search. Anesthesia provider, I'm going to say okay. And then you can change the time here if you like. I'm just going to make these two the same. Okay, and then you'll see the OR staff over here. And next, we want to update our ASA class. So let's say it's ASA 2. And then below the anesthesia type, we just want to verify the information. During the booking process, if the clerk has already selected procedural sedation, it will default to the procedural sedation. Okay, now, oh, and this blue line is the current time. So now that the patient is in the room, we want to go back to open our peri-op doc. We'll go back to the power chart. We're going to click on the peri-op doc on the menu. And then here we want to select the RHS intra-op record. Verify the patient demographic. And once you open up the peri-op doc on the tracking board, going to click refresh, you'll see this checked in. That means the patient is actually in the procedure room. Okay, so this is what the peri-op doc looks like. There are 4 mandatory segments. These are called the segments. They are mandatory as indicated by the red stars. Everything else is set up based on the procedures. Different procedures have different set of segments. And to add more segments, you click on the yellow folder. So for today, I'm just going to add a few items here. I'm going to add the briefing, debriefing, culture, and this should all be set up as a default for you guys. So the nurse normally don't have to go into the segment to add. Okay, so for case times, patients in the room, I'm just going to click on the blank. And then if you go next to save it, you'll also see this reflected on the tracking board. If I refresh, you'll say patient in the room. Okay, and next I want to go to add my case attendee. Unfortunately, whoever we added in the essay, it doesn't flow over here. So I have to add that here. Going to add a nurse. Oh, pediatric. Okay, let me do. Okay, I'll select that one. And then role perform is endoscopy nurse. The time will update automatically. You just need to click add. And then next, we want to verify our general case data, specialty, gastroenterology. As you can see, ASA class has flow from the record. Endoscopy procedure, we also want to verify this. So you click on the colonoscopy item, and then the surgical service. We want to select gastroenterology. I believe we can default this for you, so you don't have to select it every time. Okay, and then I want to modify to save it. Patient safety checklist, briefing, you can say yes, done by nursing, surgery, and the time. And culture and specimen, we can come back to this later. For your devices, your scope, you can type it in here, your scope, or just say, we'll use C36 for now, and then you can add, and then here you have your scope in here. Okay, so now that the physician's ready to give medication, we're gonna go back to our essay. So before we give any medication, we always want to do a set of vitals, and now the vitals will pull in every 5 minutes or depending on how your monitor is set. But we always want to do a set before. EKG will say it's normal sinus rhythm. And the net cons you document according to your site policy for VGH. They document the pain intensity and the level of consciousness. Okay, so now we're ready to give medication. So I click on this to-do list at the bottom. To give a medication, you can right click and add it. So you'll see here is new. We want to give 50 microgram of fentanyl. If you click OK, you'll fall back to the to-do list. If you click execute, you'll flow to the record right away. And if you made a mistake, you can always modify that. You can click on the blue dot. You can change your amount. And if you double click on the medication, you'll give the whole thing. I got 5 milligrams. And I want to change that. I'm just going to change it to a 3. And if you want to give more medication, you just click on the medication. And you'll see this new pop up again. And you'll always default to the previous dose. But for the second dose, I just want to give 1. And the total amount will appear here. Any questions so far? Okay. So now we want to go back to our peri-op doc because the procedure has already started. So we want to go to our case time, want to say start time, and all the time the in-room, the start, the stop, and the out-of-room time will flow to the essay record. So let's say the provider wants to do a biopsy. So we go to our culture and specimen. We click yes on the specimen order. Specimen type is pathology, and there is 1. And we'll say it's a biopsy. It's from the sigmoid colon. And we can just add. But this is not a requisition. I'll show you what the how to order a requisition. And so next we want to change the procedure because it's not a colonoscopy anymore. It's a colonoscopy with biopsy. So you can either click on the drop down or you can type it in. So now we want to select colonoscopy with biopsy and we want to modify it. And then you just go through the prompt, just say okay. And now it says it's colonoscopy with biopsy. So for the pathology requisition, normally it's the physician that's supposed to order it. But in case they're busy or they don't remember, you go to the peri-op summary, and then you go to your quick orders. So it's under the intra-op component, the surgical specimen. And then, oh, interesting. It's not here. Okay, but that's okay. We can search for it. So to search for anything that's not available here, you go to your new order entry. You can type it in. Pathology, surgical. Oh, unless it's not ready for Richmond yet. Could be.
Yeah, that's very common that the power plans
Yeah.
aren't often ready for the site.
It's not
Yeah.
available yet. Okay.
Yeah.
Yeah.
So it is common
Not
that
to
does
worry.
happen, but that's because our order sets are still validating everything and making sure that everything's ready before they release it for Richmond Hospital by location.
Mhm.
But yeah, essentially what Tommy is saying, so you would go in here, you can either find the order here. If not, you would find it the way that who was searching it
Yeah.
through there.
Yeah, but we'll make sure it's under the intra-op surgical specimen. It's normally sitting under here. Okay. Back to our periop doc. Okay, so now that the procedure is completed.
Yeah,
go-
before I move on, Tommy, do you want to
Oh,
tell them what
sure.
happens with the requisition? So if you did
Oh,
pull it up
okay.
and you printed it, what would
Um,
happen with
Maybe I'll just quickly. Okay. Yeah, so it's called a pathology surgical request. So once you click on it, let me show you. Maybe we'll use that one. So it's like a shopping cart. So you click on the order, and then you'll appear in your inbox. You click on the inbox, and all you need to do is to sign, and then you auto print in the ambulatory printer. So then you just have to get it, and the physicians will have to complete that manually.
That one, I think you'll have to modify the details and then enter the information there, and you will not get a report.
Well, for this one, yes, yeah, but for the pathology surgical request,
Yes,
print
those
out.
ones.
Yeah, but correct.
Yeah,
So,
exactly. There you go.
Thank you, Michelle. Okay, back to our periop doc. Okay, so now the procedure is completed. We're gonna say start time 13:59, and just for the sake of the demo, I'm going to say out of room time is 5 minutes after. Now we just have to go through the segments here to make sure everyone has a green check mark. So now we want to go to our endoscopy procedure. And we want to click away, and then you'll update the time. Want to do the same thing for the case attendee, and just click away, and you'll update the time. And we'll do our debriefing. Okay, and then we can go next. So everything's checked, and we can finalize our record. I click on the green flag, and it says there's no deficit, so we'll just click on yes. And then this is what a intra record looks like. And before we can discharge the patient from the room, we also want to complete our one-to-one discharge. So to do that, we want to go to our eye view, and then we want to find our endo quick view band. And then we want to find our sedation scale, and double click on that. We're going to use our modify our dreaded score. And then we're just going to score the patient. I'm going to say the patient is a little bit sleepy, so it's out of 9. And then I'll sign it. Okay, and that's done. So the last thing we want to do is to finalize our essay record. So if I click on finalize, and if there's no deficit, we can just go okay. And then we can sign. And then the record should disappear. Yeah. Any questions so far? So that's the intra portion. Okay. Let's back to our PowerPoint here.
Are there any other questions from the group regarding the intro procedure at all? Anything that we missed? This looks,
Hi, Michelle. I just have a question. If the patient goes into the room and decides not to have sedation, and then the patient then decides to have sedation in the room, how is that done? Can that be done, or how does it, like, what's the process for CST?
So the patient doesn't want sedation to start with, and then after wants sedation. Yeah, so you can give the sedation after. It's totally okay.
Like you document it after the procedure is done?
No, you can use the same essay record, and then you can just document it.
Okay.
Yeah.
yep,
Yeah, so for example, on the record, it'll say like the first 10 minutes, there's no sedation, right? And then after that, the sedation starts. It'll show in the record.
Okay, thank you.
of course, good question.
Yeah, and all the record is available under documentation. So we got our intra-op record here, and then our sedation record with everything, with the amount of the medication, whoever is in the room, and the time. It's all available. Okay. Do we take a short break? 5 minutes? Or should we keep going?
I don't know how everybody's feeling. Do you guys want a break, or how far are we from the?
We're maybe like 60%. Yeah, 60, 70. We just have the post-op to go through and a few more slides to validate with you. So maybe like 70% done.
Okay. I'm not sure. Ron, Deb, Sandeep, how do you guys feel?
We can carry on, Mary.
Yeah,
Keep
okay.
going. Yeah. Thank
Okay,
you.
perfect. Thank you. Okay.
Okay.
So I'll hand it over to Winnie for the post-op portion.
Awesome. Thanks, Tommy. My name is Winnie. I'm a clinical analyst with the surgery and anesthesia design team. I'm also a nurse by background. I'm going to run through the post-operative phase of the procedure with everybody. So once the patients complete their procedure, you're bringing them into the recovery area. What you'll do is you'll complete a bed transfer. You'll review their intra-op sedation record as required. And then you'll open your peri-op doc and document the patient's arrival to phase 2. If the patient's having an endoscopy procedure done, you would discontinue the procedural sedation orders and then also initiate the post-operative orders. If your patient's having a bronchoscopy, you do still discontinue the intraoperative orders. The only difference between endoscopy and bronchoscopy is that the provider must initiate the rest post-op orders. So just to keep that in mind, if you're recovering a patient, that if it's a bronchoscopy patient, you would not be initiating the post-operative orders. You would associate your vitals machine to the system so it can pull in any information automatically. Then you would document in your flow sheets and iView any intake and outputs as required, and then complete any discharge criteria. Once the patient's ready for discharge, you would complete the discharge checklist. You would discontinue the post-operative procedure plans for both the endoscopy and bronchoscopy. And finally, you would finalize the phase 2 record and discharge their encounter once they leave. I will do a quick demo here so everybody can see. Oops. Can everybody see my screen?
Yep.
Awesome. So just do a quick refresh here. So the patient that we're looking at here says that they're out of the room. And what I'm going to do is I'm going to open their chart. Double click this blue arrow here. I've already associated my relationship, but if you hadn't yet, this would be the time that it would prompt you to do so. So then I would do a bed transfer. I'm going to go into PM conversation right here and do a bed transfer. All right, so I'll just make this a little bit bigger for everybody. So the yellow fields are mandatory, and we will go into RHS day bed. Pre, post, let me just see what beds are available here. Just take this free bed here. I'm gonna do that today and now. Just takes a second and then I'll refresh. And you should see up here at the location, the patient is no longer in the procedure room and now they're in day bed in this specific room. So if you want to review any of the documentation that was done intra-op, you can go to documentation on the left side here. And then you'll see the intraoperative record here that you can pull up. You can review anything that's listed here, who was there, the case times, the procedure, and you can also see the sedation record as well. Just a little small. But just like Tommy had showed earlier, what this looked like in SA anesthesia, it's quite similar. So you can see this patient got 4 of Midaz and 50 of fentanyl. Right. So now that the patient's with me in recovery, I'm going to document their arrival to phase 2. I'll choose the phase 2 record. And I'll just click here to say that the patient's arrived to phase 2. So I just want to show when you hit next, and that little screen popped up, but I did that so that this would show, it would reflect that the patient was in phase 2. So when you're like if you have any of the big tracking boards on their screen or anything like that, you'll be able to see the status update once it's been done. All right. So now I'm going to go into orders on the left-hand side here. And I don't need the procedural sedation orders anymore. So I'm going to go ahead, right-click and discontinue them. If I wanted to keep anything, I could select any of these on the left-hand side, so they would not be discontinued. But in this case, I want to discontinue everything. So I'll just type in the surgeon's name. There we go. And we'll sign that. Just refresh. And I see that the pre-procedure here is discontinued already, and this post one has also been discontinued. This is the one that I just discontinued. And I'm going to initiate the post-procedure plan, which I'll right-click and hit initiate now. Because this has already been ordered by a physician, I don't need a co-signature. So I'll hit orders for signature. You can see on the screen what's going to be ordered. And just sign for them. So now this post-procedure now says initiated instead of planned. And these are all the orders that I have to act on. This is a GI endoscopy order set. If you had a bronchoscopy patient, you would not be initiating the post-procedure. The patient ideally should come to you in recovery with the procedure, the post-procedure portion already initiated by the provider. So I will probably start off with documenting some vitals. if you had a Masimo or some sort of like medical device that you could associate, you would do that with this device button here. But if you just have the Dynamaps, then you would just document them normally. So you could do that here. So any of your vital signs you could put in. Yeah, you would just go down here and put all that information in there. And you would hit a check mark to sign. Other things you want to document other than vitals might be something like sedation scale. So when you're receiving the patient, how they're doing. Well, that's lower than what it was initially, but. And then you would also document things just going down the list. The next thing that I would do is I'm going for pain. So you would document if the patient had any pain. If the patient was nauseous, there's nausea right here as well that you would be able to document. If you had to give any medications, it would just be through the medication administration wizard closed loop administration at the top that Tammy mentioned earlier. So let's say the patient's recovered now and you're ready to discharge them. And you've gone through and you've documented, your sedation scale. Other things that you would document is your post-procedure patient discussion. So whether or not the patient expressed any concern post-procedure, you could say no. The discharge criteria right here on the left, make sure the patient has controlled nausea and vomiting, dressing site dry and clean, controlled pain. And then you can document that. So to update the tracking board, you want to make sure you go back into Peri-Op Doc and just click here. It'll populate with the current time to say that the discharge criteria has been met for the second phase. You'll hit next, and it should update as well. Oh, I guess this is pre-op, sorry. This would be post-op. Sorry, I was on the wrong tracking tab. Originally, I was in here, but really I wanted to be looking at RHS endo post-op. So you see that this patient is now ready for discharge. So other things I can do here is discontinuing any IVs. I would do that here if it was documented. And then once the patient's ready to go, you would do a discharge checklist. In your endo, there's a discharge checklist here. And just run through this information if there's any follow-up, discharge summary, anything that was arranged. And then also remembering to scroll down to make sure you also get this field, patient expresses concern post-procedure, how they were accompanied, how they went home, and any additional comments you wanted to make, you could do so here. And then just a check mark to sign. So we'll also discontinue the post-procedure orders now that the patient's ready to go home. Same as we did before with the right click, discontinue, and okay. And just sign for those. Great. The last thing we want to do is just to finish off our perioperative documentation with the patient leaving phase 2. I'll just click that, the time will populate. And all the times are filled out. We've got a green check mark here, and we'll sign the green flag here. It says it's verified and finalize, and yes. And this is complete. And that would be the process of sending a patient home after an endoscopy or bronchoscopy. Are there any questions about how the recovery process would work, any of the documentation, or any questions that you might have? Great, I will pass it back to Tommy. If there's anything at all, you can always let us know or post in the chat.
Yeah, I just wanted them to take a look at the tracking board, and were there any concerns about that? Because we will validate that and show that the tracking boards are the way that they're built, and we will move on, and then we'll go into some questions that we have for you.
Sure, I can show the tracking board. Is that what you're asking, Michelle?
Yeah, please do. Or one of you, or Tommy or somebody. if
I
you have
can
it
do
open,
it.
Tammy.
Oh,
Yeah.
okay.
And so you could just show them what we had built and the different ones that we have. And then, and you know, even like yourself, when you were looking at the wrong tab, it was great that you did that during the demo because it can happen here. And what you did is that you went to another tab, right? So it's like something that's very common that can happen in real life practice. So I think it's excellent that you show that those are the different tabs that we have and how they will navigate around that. So it's perfect. Yeah.
It was a happy accident. So
Yeah, I
obviously
know.
there's
It
a
was like, it
lot
was a
of,
really good one. We'll say that you did it.
there's quite a few tabs here. So I'll just bring your attention to these kind of hot pink ones down here that are RHS specific. You will not see all these tabs for all the other places, but we've got a RHS endo pre-op. And then once the patient's in post-op, you have a post-op, RHS endo post-op. I believe there's also an RHS endo provider. Were there any other tabs that we should call out here?
No, those look good to me. Do you have any questions or concerns?
Hi, it's Mary. It looks pretty foreign to me. So I think once we start getting into actually using it, I think more of the clinical part will be more of a question, but overall, it seems to look like it will work. So I don't know if Ron has anything to say, but as far as what it's presented, it makes sense, the flow. So just hopefully that Richmond, we can make sure we enterprise that into our process.
I've had some experience with Periop Doc, so it seems fairly straightforward right now.
Wonderful. Okay. We'll consider it validated and then we'll have Tommy continue on. Thank you. Thanks, Winnie, for showing that as well.
No worries.
Thank you. Okay, back to our slide. Okay, we have a few things we would like to validate. The first is for the urgent endoscopy add-ons. So for schedule our add-ons, a request for endoscopy order comes from the physician and it prints to the ambulatory space where the ambulatory clerk schedule on current encounter using the surgery rapid appointment type. So this is pretty straightforward, but for after hour add-ons, we're wondering if the site has decided on who is going to schedule these after hour cases. Is it going to be the on-call endo nurses or the OR clerk, and whether the OR clerk is available 24 hours?
Okay, so for at the moment, the process is still pending. We do have Sandeep online, who is an OR NUA, that I've asked to listen in, because I think our goal is to possibly go through the OR NUA so that the endo nurses have it ready for when the procedure happens. Now, the only thing is if we don't have an OR NUA available 24 hours, they're only in the weekends and evenings until 10 o'clock p.m. Monday to Friday, and then weekends it's just day shift. So that's the only thing we have to clarify to make sure, because if we're not going to have OR NUA 24 hours, which I doubt we're going to have, we may have to get the endo on-call nurse to do that scheduling part. So it's just still pending, but I think once we have that, because right now our endoscopies that are after hours have a bit of a flow, but usually done at a certain time. So it's a really hard question to ask, but a very simple answer once we figured it out. So at the moment, can I just leave that pending until I've clarified and confirmed that process?
Yep, that's totally okay.
Absolutely.
Yeah, just to let you know what other sites are doing for VGH, because UBC doesn't have any after-hour add-ons. So for VGH, the nurse does the scheduling. We teach the nurse how to do add-on schedule because sometimes the clerk is not there, and during schedule hours, the nurse has to know how to add those add-on procedures into the scheduling book. So all the nurses will be trained on how to schedule an appointment.
Thank you, Tommy. That's good to know. Definitely that's an option that we have to look at. So thank you.
Yeah, no problem. Okay. So the next is for procedure that's done with an endo nurse, the appointment type they use should be the surgery rapid appointment type. And for procedures that are not done with an endo nurse, for example, certain like ED or ICU cases where the physicians don't bring in an endo nurse, booking has to be done via the surgery minor appointment type. So this is because the surgery rapid appointment type require the peri-op doc to be documented on. Otherwise, there's going to be an error sent to the SPR, whereas the surgery minor appointment doesn't require this. So it's a little bit different. And then we were also wondering, currently, do you report these emergency add-on procedures to the SPR?
So the inpatient within working hours are reported to SPR because we submitted them as inpatients.
Yeah.
Anything that's captured on the weekend or post, when we get back to work on Monday, we don't capture those cases and we don't submit it through RMS scheduler, so they don't go through SPR. So that's the only thing, because RMS doesn't allow us to enter cases after it's been done. So we have to just kind of leave it pending. If we do know ahead of time, like on a Saturday, let's say, which I don't think it's ever happened, and we know the date on a Friday, we're going to do this clinic, we'll put it through. But other than that, they don't get submitted. Only the working hour ones get sent to SPR.
Okay.
Patients, yeah.
So in that case, I'm wondering whether for the cases without endo nurses, maybe we don't even need to schedule them, because if they're not sent to the SPR, it's just in terms of documentation for the provider, there are going to be like two streams. So the first stream is to schedule all the cases, so the provider can document on EndoPro. And if they don't schedule the cases, then the provider has to document in Cerner. So I think we just have to.
That's a good question, because when our logging clerks, let's say, for the bedside ones, it's difficult to say, because I mean, we have a portable that goes to the bedside and does it, but if we can capture, we capture it, but if we don't, we don't. So that's something we have to put back and make sure that we either document it or not.
Okay.
Doesn't really answer your question, Tommy.
No,
Sorry.
no, but at least we know these after-hour urgent cases are not sent to SPR, so that we know.
Yeah, if we don't capture them,
so we can think about. So we can think about whether we need to schedule these cases. So the same goes for bronchoscopy, actually. If I go to the next slides first. So we understand bronchoscopy add-ons, they are not sent to SPR, regardless of whether they're scheduled or after hours. So there's not a requirement to schedule these in Cerner, unless you want to run some kind of stats. Do you need to track those urgent bronch add-ons?
We do track the ones that are, well, we don't even log them. They don't even get sent to SPR. We just record them through our ORMA scheduler. So if we ever needed to run numbers of how many bronchs or how many, whatever we needed, we don't even put them on a wait list. So, I don't think we've done that. We need ambulatory care support on an urgent one, because they do them on their own with RT help. But if they're done on our suite, then we do schedule them as an inpatient. So I think the scheduled hours versus the after hours, we don't track them. the after
Okay.
hours.
And I'm not too familiar with ORMUS, Michelle. Is more ORMUS going to stay on after Cerner?
I think Ormus is gonna be disappearing after.
Oh, I see.
yeah.
Okay. So if you track in ORMUS, then we have to find a way to track these
Yeah, we have to be able to,
bronchoscopy orders. Okay.
yeah.
Yeah.
Okay.
Sorry,
in
I was
that
on mute
case-
there. Yeah.
No, it's okay. In that case, I think we still need to schedule these cases. if we
Yeah,
want
I'll
to
take that
track
back
it,
and we'll
right?
figure out a way to see what we could
Yeah,
do, because
okay.
it sounds like from an SPR perspective, you don't need it, but if you need it from
Mhm.
a tracking method, so we'll see if we can find you a way to help track your numbers to make sure you
Okay.
can keep that going, and we'll just take that back to our team and discuss. And then
Perfect.
we'll connect in with you, Mary.
Okay, thanks, Michelle.
Thank
Yeah,
you.
of course.
Okay, next. A few more things here. So for add-on, we just want to validate this one. So currently the procedures that are not done in the endo suite, the unit nurses are responsible for administering medication, monitoring vital signs and documentation, and the endo nurses are only to document the case times. Is that correct?
Ron, can you answer this one? I've never been, but do you have any familiarity on the bedside part of it when they go like to ICU or emerge?
Sorry, guys, there was a lot of background noise. Can you repeat that for me, Tommy?
Oh, okay. It's just for procedures that are not done in the endo suite. The unit nurses are responsible for like giving the medication, monitor vitals, and documentation. And the endo nurses are only to document case time.
Yes, that's correct.
Yeah, okay, good. So in the Cerner sense, then other than the case time, then you would have to complete all the 4 segments in the peri-op doc. That's the only difference.
Oh, okay.
Yeah, because they're required.
Okay.
Yeah, okay. And then, so there's not going to be an additional printer provided to the ambulatory space. So we're just wondering, is it a long walk from the procedure room to the ambulatory space printer that you currently have?
No, it isn't.
Okay, because a nurse has to come out of the room to grab the requisition. So it's not too far.
I mean, we can always ring out and ask the clerk to bring it in for us.
Oh, that works too.
Mhm.
Okay. And then in terms of the fax lines, you would like 3 fax lines, 1 for bronch, and that's for the bronch electives and add-ons. Second one's for endoscopy inpatient for the add-ons only. And the third one is minor surgery. Does this sound pretty good?
Yeah,
Sure, what relevance the fax lines have. Sorry, you might have to explain that one to me.
I guess it's just that it doesn't come to the same fax line if there's like a lot of procedures, so it's separated.
I think what he means, Ron, it's for the queue for the booking clerk, so that
okay.
if they
Yeah.
see Ron coming through, whoever the clerk is will focus around versus that mixed up on with all the other lines.
Yeah, that's exactly right. So if a booking package comes through, if it goes through to the bronch line, then it's clear that that's for the bronchoscopy cases versus having minor. So we're separating out bronchoscopy, endoscopy, and then minor procedure as well.
All right.
And so the clerks will follow 3 queues.
Yeah, so for the endo nurse, it is not that relevant. Okay, thank you. And in terms of the monitors, this is what we have. So you have 10 monitors in the pre-post area, and then 2 in each room. Sorry, 1 in each room for endo, so 2 in total for endo, and 1 in bronch, 13 in total. Does that sound about right?
We will confirm that, Tommy. I just want to make sure we have it. It does sound right, but I don't want to miss out on anything. So we will confirm that.
Okay. And our last question is about a TV tracking board, or what we call the grease board in the ambulatory space. So our question is, would you require a TV tracking board? And this tracking board is similar to the standard peri-op tracking board that the nurses and the clerk have access to, but without the patient identifier, because everybody can see it. And on the TV, it can only show one tab at a time. So if you want to switch between the pre and post tabs, you will have to do it manually. So currently at VGH, they have one board, and for UBC, they do not have a board. So it's totally up to you whether you want a board or not.
That's your call, Mary.
So, but this board can be viewed by anybody, right? On the
Yeah, it
wall?
depends on where it is. With a board that physically goes on the wall, think about a giant TV that goes on the wall, and basically we remove the patient identifiers, and that's why you can see one tab or not, because you'll control it at the computer. But because it's visual everywhere, some sites have chosen not to utilize it, whereas some sites have chosen to use it. A lot of the nurses may opt to just look on the WOWs or on the desktop computers at the tracking boards, and then they go through their workflow via the computer instead of using up on the wall. However, some sites like VGH liked it because then they have that quick glance to look at it and say, oh, there I go over into room 3 or wherever, and it's a visual that's clear in the
Kind of
open.
convenient.
Sorry?
Sorry, Michelle. Yeah, for VGH, I think it's because they have a lot of fellows and residents, so it kind of makes sense where they can just go to the TV tracking board and see where the patients are.
I think because in our site, it's like the 2 rooms for now, right? So, and it doesn't show the patient. So typically I was thinking more for like the nursing or unit clerk, when a patient gets picked up by their family member, we like to know where they're at on the board. But if it doesn't identify the patient, really doesn't really give that information.
You'll have the patient initial, but the clerk should have 2 monitors, and the clerk can put a tracking board on 1 monitor.
Right. So that would be really the thing. I think I'm gonna opt to say no, but I don't want to take that that decision without putting it out to the group. But I don't think for our site it would be something that would be quietly required, because we don't have, I mean, we all have the WOWs and we'll all be able to, and as long as the unit clerk and the recovery nurse is aware where the patient's at on this tracking board, then I think that's mainly the issue. And then the doctor can view that too in the room as well, right?
Yep, correct.
Yeah, so, okay. I'm gonna say no for now. But let me, I'm just gonna be back to work on Monday, so I will confirm 100% on Monday.
Okay, thank you.
Thank you.
And that's all our questions. No more sessions. That you may receive more emails from us to clarify your workflow. Is there any questions from you guys?
No, I'd like to thank everyone. Thanks, Ron, for logging in, and Deb and Sandeep. I know it takes time from your work, but I do appreciate that. Your feedback is really important. And Rana, our endo booking clerk, was short-staffed, wasn't able to come in. So, but I will make sure she watches the recording. So if she has any questions or clarifications, we will make sure we send that out to your team. Thank you so much.
Thank you. And if there's more questions, feel free to email us.
Okay, thanks, guys.
Okay, thank you.
Yeah, thank you. And Mary, look out for an email from us, because we had just a few follow-ups that we said we would connect in with you. So we'll do that.
Okay, perfect. Thanks, Michelle.
Okay,
Sorry,
thank you.
Okay, take care.
Yeah,
We appreciate your time. Bye.
I'll try to send it back as soon as possible, Michelle.
Okay.
Yeah, no worries. No worries.
No worries.
Yeah.
All good.
That's okay. Thank you, everyone, for your time.
Thank
Have
you.
a good day.
Bye.
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 Bye.